Great. Okay. So hello everyone. Thank you very much for coming. And if you can't hear me or anything, please just let us know in the chat. Um, so welcome to the Research and Practice Fellowships for Health and Social Care Practitioners webinar. My name is Marta Pisarska. I'm a project officer. And today with me is Annalisa Montesanti, who's the program manager looking after the health careers portfolio. So I will give you an overview of the webinar. First, I'll talk about the aims and objectives, the scope of the scheme, key changes from CSF, from the clinical scientist fellowships, because as you may know, this scheme is based on the CSF scheme. Then I'll talk a little bit about the funding duration and the start date. We'll spend a good bit of time on the eligibility criteria, and then the application assessment process, and then a little bit on the HRB narrative style CV, and then the time frame for the scheme. So the aim of the scheme is to provide opportunities for talented health and social care practitioners from a variety of professional backgrounds to conduct research at post-PhD level or postdoctoral level, while they are continuing to deliver health or social care as practitioner researchers. So this scheme falls into place for people who either already have a PhD or they have PhD level experience. So to clear it a little bit, who do we target with this scheme? So we are targeting practitioner researchers, who we define as health and social care practitioners who combine research with health and social care practice, and whose work span the academic and health and social care setting. So we're targeting individuals who are currently involved in delivery of health or social care practice, but they're hoping to progress their career simultaneously in the research, with the research aspects involved. So we're hoping that the social health or social care practice will inform then the fellows' research as well, and vice versa. So there are three main objectives to the scheme. So first one is to support practitioners to consolidate their research skills and expertise post-PhD, and then to allow them to progressively develop themselves as more independent practitioner researchers, research managers, as well as future leaders. And the second objective is to enable the prospective fellows to form multidisciplinary and or interdisciplinary collaborations with academic partners and knowledge users in relevant policy and or practice organizations. And then the third one is to provide fellows with the direct experience in conducting applied health and social care research projects, which are aimed at finding practical solutions to specific problems or to reduce the evidence gaps in the area of their expertise. And the projects should have a clear pathway to impact on the quality and experience of service users, and then ultimately on the health outcomes. In terms of scope, there are three main eligible areas for the project. So these are the clinical research, health services research, and population health research. So the definitions are included in the guidance notes for this scheme. So I will invite you to read them before you apply, to make sure that your project is in scope. But if you have any questions regarding the scope, please don't hesitate to contact us and we can discuss it before you submit your application. I'll talk a little bit about some examples of projects which are ineligible. So we wouldn't fund projects which are basic biomedical research, and any projects which are involving cell lines, animals, or their tissue, preclinical studies which would involve evaluation of potential therapeutic interventions in cell lines, animals, or in human samples where the primary outcome is exploratory. We wouldn't consider eligible projects which are looking at which which are looking to evaluate a clinical trial or other interventions, because we already have a different scheme aimed at that investigator-led clinical trials program, ILCT, which is currently a rolling call. We wouldn't fund applications which are solely literature reviews, systematic reviews, audits, surveys, needs assessment, technology development. And although we wouldn't fund them as a standalone project, they can form an element of your research study. And we also wouldn't fund applications which are solely or predominantly developing infrastructure for biobanking databases or patient registries, and they don't have a predominant research element. And then in addition to that, we wouldn't fund any research which intend to create human embryos solely for the purpose of research or for the purpose of stem cell procurement. And then also we wouldn't fund applications from individuals applying for, holding, or employed or under receiving funding from tobacco or alcohol industry or related actors. And then in terms of changes from CSF, so CSF the full name is Clinical Scientist Fellowships. This scheme is based on that model. And I will go through the main changes. So we changed the name to Research and Practice Fellowships for Health and Social Care Practitioners, hoping to attract individuals not only medical doctors, but also from the wider professions of the health and social care practitioners. And to do so, to even further kind of strengthen that up, we introduced 2 funding streams within the same call. So one for medical practitioners, and then one for the health and social care practitioners who are non-medical doctors. So within each stream, they will be assessed, again, using the same assessment criteria, the same process. They'll have the same application form, but they'll be assessed separately. And again, that is to promote a little bit more, hopefully having more applications from the health and social care practitioners. And you will notice when you go into our grant application system that there are 2 separate application forms, one for the medical practitioners and then one for the health and social care practitioners. And I will ask you to take care when you're choosing one or the other based on your profession, because again, that will help us to streamline it, to stream them into two streams. And obviously we will be checking that the applications are in the correct streams, but I'll ask you to take note of that. We changed the assessment criteria weighting a little bit. So it used to be, so the lead applicant used to have 40% of the weighting because it is a career development scheme, but now we changed it a little bit, and the lead applicant and the project are weighting the same 35%, and then the support weighting is 30%. We also increased research-related cost cap from 50,000 to 80,000 for the duration of the fellowship. And then we shortened the gap between the end of PhD and the start of the post-PhD period and changed the PhD eligibility criteria. So before, when applying to the scheme, the individual had to have their PhD and their viva completed, but now we're allowing applicants to apply even if they don't yet have a PhD completed, but we're asking that you have your PhD completed by the 31st of May 2026, and we'll be asking for a proof or a letter that you have successfully completed your viva by the time of shortlisting, so early June 2026. And then we extended the application stage, which used to be between 10 to 12 weeks to 18 weeks, to allow to provide you with a bit more time to develop your applications. Then in terms of funding, duration and start date, we will provide funding for your pro rata salary related costs between 0.3 to 0.5 of FTE. So the reason for that is you can have, as per your eligibility criteria, you can have already up to 0.2 FTE of research protected time. So instead of buying out let's say, a full 0.5 FTE of your clinical time, you can ask HRB to buy out 0.3 of FTE of your clinical time. And if you can, dedicate fully the 0.2 of research protected time that you already have to the fellowship. But the total time that you have to come into the fellowship is 0.5 FTE of research time. And then in addition to your salary, we will provide funding up to 80,000 for research-related costs over the lifetime of the fellowship. And we do not provide overheads contributions for fellowships. In terms of start date, you can start at any time between January and December 2027, and duration of your fellowship must be between 48 and 60 months. Now we'll move on to the lead applicant eligibility criteria. So the general criteria, you have to apply from a HRB approved host institution, which is based in the Republic of Ireland. So this call is not open to HRB approved host institutions from the Northern Ireland, and there is a list of HRB approved host institutions in the Republic of Ireland on our website. You can only submit one application to the scheme, and you must maintain a 0.5 FTE in health or social care practice, and then dedicate the other 0.5 FTE of research protected time to the fellowship. So reduced commitment, practice commitment might be considered, but it cannot be less than 0.2 FTE, but it has to be strongly justified. And as I said before, we'll buy out between 0.3, which is a minimum, and a maximum of 0.5 of your health and social care practice time or academic non-research time. We won't buy out your already existing research time. And then on top of that, you'll have to fulfill the eligibility criteria under qualification, employment status, and then career stage criteria. And I'll go through them now. So in terms of qualifications, the lead applicant must have completed their professional training. Medical doctors can be at SPR level, and you must hold PhD or demonstrate PhD equivalent research experience or defend your PhD thesis before the 31st of May 2026. And as I said before, we'll require an evidence of you passing that PhD viva before at the time of shortlisting, and no later by the 5th of June 2026. So some of you may have already applied for PhD equivalent research experience in the past with the HRB. We have updated the process a little bit, but if you already applied, that's okay. We will accept your previous. You have been approved, so there's no need to reapply. But to anyone who wants to apply for HRB PhD equivalent research experience, the requirements changed a little bit. So the more details are provided in the guidance notes, but also on our website, along with the application form. So in short, the lead applicant will have to demonstrate 4 years of FTE postgraduate research experience, which will be measured from the time of you obtaining the primary degree. It doesn't have to be constitutive. It doesn't have to be, let's say, 1 FTE as a block, but it can be spread over time. But overall, it will have to add up to 4 years of FTE. And that's the way it used to be. But now we'll be asking you to provide evidence that this research that you have conducted resulted in original and verifiable contribution to knowledge, and must be supported by documented outputs such as publications. If you will be applying for the HRB PhD equivalent research experience, you have to submit your form at the latest by the 30th of January 2026. In terms of employment status, at the time of application, you can be employed in the Republic of Ireland or any other country. You can be on a career break or in the final stages of your PhD. But if you are not employed in the Republic of Ireland at the time of the application, you will have to show that you have the support of a HRB approved host institution to apply. and you have to demonstrate that you already obtained a position in the Republic of Ireland, or you are already negotiating a post in the healthcare or social care services organizations in the Republic of Ireland. And then in terms of employment, you must be employed in the Republic of Ireland by the start date of your fellowship, and you must hold one of those positions. So you can hold a clinical post in the Irish Health Service or Social Care Organisation. It can be permanent, or it can be on a fixed term contract. But the contract must cover the length of your fellowship, with the exception for medical doctors. If you are at SPR level, I'll provide a little more information about that on the next slide. And then you can hold a clinical post in a private practice, which is in providing inclusive care to the public. So like GPs or private physiotherapy practice, private dentist practices, etc. Or a post in a health or social care organisation like TUSLA, or a joint health or social care and academic position within a higher education institution and an Irish health services or other social care organisation. And you cannot have more than 0.2 FTE of research time in that contract to apply. If you're a medical doctor, that's those conditions also apply to you. So if you're a consultant, you should not provide private practice during the fellowship. So if you have a Type B or C contract, you must negotiate with your employer a work plan which will exclude your private practice, and that has to be confirmed in your employer's support letter. If you don't have a permanent contract, such as if you are an SPR, you must have endorsements from the head of the school, of the medical school. And that again must be confirmed in the letter of support from your host institution and must be signed by the head of the school. We will be allowing only public only contracts, or the POC contracts for new consultant posts. But if it's not possible, again, applicants must provide a letter from their hospital group and HSE confirming that no private practice will take place during the fellowship. And as I said before, medical doctors who are completing their specialty training are eligible to apply, even if the contract will not cover the full duration of the fellowship. But once your training is completed, you will be required to hold one of the positions that were listed on the previous slide. In terms of the career stage, you cannot be recognised as an independent investigator, because this scheme and those fellowships are aiming to support people to develop the necessary skills for the future to have, to lead a research team. So you will be ineligible if you received a substantial research grant previously of 100,000 or more as a lead investigator or lead applicant, and if you are leading or led a work package in funding schemes from the European Commission. If you received a grant, which is a personal grant, like a PhD scholarship or a postdoc grant, you're still eligible to apply. You cannot be leading an existing research team. You will be also considered ineligible if you acted, or if you are acting as a primary supervisor or sponsor of an early career researcher, like a PhD or a postdoc. And also, if you secured any research grant as lead applicant, which supports personnel and building of research team, you will be also considered ineligible. And the host institution will have to confirm that you are not an independent investigator in their letter of support. Well, yes, yeah. And then in terms of the applicant team, you'll have to have a mentor. That is mandatory, and that should be an individual who will provide support and guidance during the grant, for the research project, for your career milestones and the research vision. They should have expertise in applied research, but also in capacity building and career coaching to provide you with that support, and also to help you to acquire the necessary skills for applied research. In terms of collaborators, they are optional, but usually these applicants have collaborators on their applications. You can have a maximum up to 10 collaborators. They can be from outside of Republic of Ireland. And they can be either an individual, they can be an organization, but they have to play an internal and discrete part in your research project. They can be a researcher, they can be a knowledge user, data controller, processor, or PPI contributor. These are the categories that you can use when you're applying. And collaborators may be, for example, providing you with samples, or they might be providing you with access to specific equipment or training, or they may act in advisory capacity. And they can come from a background of a varied background. So they can come from academia, they can come from private sector, and more information again is available in the guidance notes. In the fellowships, we have no co-applicants, and you cannot apply for PhD researchers or MD researchers or any salaried staff under the scheme. So now I'll go through the steps of the application assessment process. So as I said at the beginning, at the application stage, the applications will be streamed into 2 streams based on the professional background of the lead applicant. Then they'll go on the scientific and public review. Then they'll go through the process of shortlisting, an applicant response phase for the applications which have been shortlisted. And then those shortlisted applicants will go through to the panel interview as well. And then the panel will recommend which applications should be funded, and that will go for HRB board approval. So we are aiming to fund up to 10 applications, 5 within each stream. And I will go into a little bit more detail about the application assessment. So each of the application will undergo a peer review and public review. The peer reviewers will focus on the assessment criteria for the scheme, and I'll discuss that in 1 second. And then the public reviewers will focus on the PPI quality within the proposals. So in terms of the assessment criteria, as I said, there's a little bit of change in the weighting, but the reviewers will still be assessing the lead applicant, the research project, and the support for the lead applicant in the project. So in terms of the lead applicant, they'll be looking at the potential of the lead applicant to become an independent researcher and a potential leader in applied health and social care research, but they will also look at your training and professional development strategy, as this is a career development scheme. They will assess the relevance and impact of your project, but also your research design and feasibility. And then in terms of support, they will look at the research team that you have invited, and your mentor, and the support that you'll receive from them, but also at the choice of your host institution and the wider support. And although PPI is not a standalone criteria, it will be taken into consideration under any of those assessment criteria where it will be considered relevant. So once the peer review and public review is complete, we will go into the shortlisting stage. So the applications will be ranked within each of the streams based on the peer review scores. And then the highest ranked 7 applicants in each stream will be invited to respond to the reviewers' comments. And then they will be invited to interview with the panel. And then at this stage, the panel, each application will be assigned to a primary and secondary interviewer. The panel members will review the applications based on the assessment criteria, but also they will take into consideration the peer and public review comments, and also your response to those comments. And then the panel will recommend for funding up to 5 applicants within each stream to the HRB board. And I'll go a little bit, I won't go into too much detail about the HRB narrative style CV, but because some of you maybe never used narrative style CV, I'll just kind of give a high level overview. So HRB is a signatory of DORA and a member of QARA, so we're committed to the common principles of assessment of research and researchers, and we recognise that we should be assessing a wider and diverse outputs and practices, and that requires more a qualitative judgment. So the aim of this CV is to highlight your key contribution, but also provide the context relevant for those contributions. So we ask you that you don't copy and paste the contributions from a traditional CV straight into the narrative style CV without providing the context for those contributions. You should be highlighting how you contributed, why you contributed to that particular area, and give a little bit more context. The questions within the narrative style CV that are included in this application form are standard questions for these applicants and also mentors for all career stages. So they're exactly the same. But we understand that at this point in your career, you may not have you may not contribute to every single area which we're asking about, and that's fine. You're not required to provide details for each of the 4 subcategories of the contributions if they're not applicable or if they're not relevant yet to your career. I think in the application form they're made mandatory, but you can just write that it's not relevant yet to your career. And that's okay, because the panel, the peer reviewers and panel will take into consideration your active research experience and when assessing, the competitiveness of your track record. And also there's an area where you can put in any details of your any career breaks if you wish to do so, and that is not a mandatory question. And then in terms of time frame, the call is now open. It will close on the 13th of February 2026. Then we'll start eligibility assessment, and that will finish by early March. And this is when the scientific and public review will take place until mid-June 2026. And at that point, we will do the shortlisting of applications. And this is also the point, if you're currently completing your PhD, to submit the proof that you have successfully completed your Viva. Once the shortlisting is complete, we will ask the top-ranked applicants to respond to the comments of the peer and panel of the peer and public reviewers. You will have 10 working days to do so. So that will end by the end of June of 2026, and then the panel will have time to review the peer and public reviewers' comments and your responses to those comments. And then the panel interview meeting will take place in early September 2026. Then the panel will present their recommendations to the board. By the end of September 2026, we should have the outcomes. And then the projects will start between January and December 2027. So that's the wide overview. If you'll have any questions at any point while the scheme is open, or while you're completing the applications, if you have any questions about eligibility, please do not hesitate to contact us. I'll be probably the first point of contact for you, and then I can always consult with Annalisa, with the program manager. And we can always discuss it over a call or over email, whatever is more suitable for you. So that's it. Thank you very much, and we're happy to take questions.
Currently, there are no questions, so it must be very clear. We wait a few minutes in case questions come in and we can address them. They're coming in. The first question is, can I ask if restriction on independent investigator apply only at time application? Yes, so the eligibility is once completed and you are eligible. If things change during the application review stage, we are not going to make you ineligible during the process. So if you can use the question and answer section, that would be great. I'll probably stop this one. Another question is, if I am successful in an application for the scheme, is there a way to know where the ECSA call, then Emerging Clinician Scientist call, will be next launched to plan for next career stage? Yes, so we're not planning any ECSA or similar scheme in 2026. So will probably be launched sometime. Will be probably launched sometime in 2027. So you're going to know if you're successful in the RPF call before planning for the next ECSA call. So another question, would we consider strong justification for practice time of 0.2? This is very much in terms of flexible work arrangement. So if you are taking, for example, parental leave, or you are reduced hour for, personal circumstances, taking care of people in your family and so on, we would take in consideration a reduction of your clinical time to 0.2. Let me see some other. Is the panel interview an actual interview with the lead applicant? Yes, absolutely. So people that are shortlisted in June, then they will be invited to an interview with a panel. Will be the lead applicant who will be invited. Is there any time limitation between the time of finishing the PhD and applying for the fellowship? No, so it's quite flexible because we know that the route from, is quite diverse in terms of career route for different discipline or different individuals. So there is no limitation like you have to have from PhD to applying for fellowship, let's say for 3 years. So no, you can have done the PhD even 10 years ago and apply. Would those panel interviews in September be in person, remote, or both? Will be in person. So there will be really very, let's say, exceptional circumstances. We will move one person maybe virtually, but typically they are always in person. So based on previous funding call, do you have a rough idea of how many applicants are expected? Applicants, so the last CSF, I think there were 16. I think 16 applicant only. I really hope there will be more, which means, of course, the success rate is less, but I really hope there will be more people applying in this call. So I would expect maybe around 25, but it's just a number. So could you describe what you mean by active research experience that is taken in account? So is this only when employed as a researcher, can be research undertaken while working clinically? It depends on the circumstance, but active research experience is when you have been working. So let's say, so what we mean is not the academic age. So like say you are being a postdoc for 3 years and then for 2 years you work clinically and the PhD was 5 years ago. We're not taking consideration that academic or professional age, but we're taking consideration the time you spent in research. Could be 0.3% for 3 years and maybe nothing for the following 2 years and something like that. Let me see something at Would a separate postdoc scholarship award make you ineligible for this award? Sounds like it wouldn't, particularly if not awarded at the time of application to this scheme. No, if you've done another postdoctoral fellowship and you think you still want to have postdoctoral experience before going to the next stage, which is maybe the emerging clinician scientist, you can apply. There is no restriction to have done another postdoctoral. Now, you have to consider that this is a postdoctoral opportunity for everyone, and you probably have to make, you may provide a rationale why you need another postdoctoral stage, but absolutely is not ineligible. Is it possible to apply if currently working Republic of Ireland in a full-time research post, provide a letter of support from an appropriate clinical organization for clinical post during the fellowship is provided? Yes, if you are at the moment in a sabbatical, let's say, or secondment for research purposes, you can apply at time of application, so at time of taking the fellowship, we are not buying research protected time that is above any research protected time. So you have to move to another post, let's say clinical post. At that point, we are going to consider that post that you're going to take when starting the fellowship. Let me see if there are another question. Is one for GP applicants. Is there a similar contractual requirement to consult and a limitation regarding non-GP clinical work? Any contract length required? I'm not entirely sure about this one. There are different requirements than consultant because they don't have the same post. We might take this offline if people want to contact us directly just to know a bit more what this means. Let me see if there is anything. So could you say more about the limitation around using research cost funding to hire staff? If the intervention being researched involve a staff member to help deliver non-research staff, is that okay? So you can't hire anyone, any salary research staff under this. This is a fellowship, is an individual award, an individual grant that is basically supporting you to conduct research. So the only thing, in case you need maybe some support to conduct research, has to be done through running costs, but not through salaries. So it could be like field work for some hours to support your research, but it cannot be under a basic salary or PhD stipend, because this is just really supporting you to conduct research. I think I have answered most of the most generic question might be useful for everyone. So I think there might be some that might be useful to review the FAQ. Marta will compare with the question that we received, and anything that we haven't addressed, please contact us through the email address that you have, and there is in the guidance note, and we can answer the question as soon as possible. The PDF version of this presentation will be on the website in the next day or two, and also the webinar recording will follow. I don't know, Marta, you want to close this?
Yeah, well, thank you very much. As Annalisa says, with any more specific questions or the questions that Annalisa hasn't answered, please contact me directly, probably first, and then we can discuss it further. And well, thank you very much for attending, and hopefully I'll see applications from you soon. Thank you very much.